Happy Migraine Awareness Month, everyone. Our theme for this Migraine Awareness Month is Your Migraine, Your Way. And what we mean by that is you take control of your migraine journey so that you can live the best life you possibly can with migraine. Now, one of the people you probably don't think can help you is your local friendly pharmacist. Yeah, I do mean the person in the chemist that you get the drugs from. They're actually pretty interesting people. And to help us do that is Nicolette Ellis. She's the senior clinical pharmacist at Beyond Pain. Thank you for joining us, Nicolette.
Hello, thank you.
Really great that you can be here. So we all know, that there's a pharmacist and they give us drugs, right? That's about the extent of most people's understanding. But pharmacists are actually pretty highly trained professionals, right?
Pharmacists are really highly trained specialists in medicines, and our entire university degree is about medications. So we actually spend 4 years at university learning all of the mechanisms of action, of how the medicine works in the system, the side effects, managing the risks and benefits for patients in using medications. So we have a really in-depth knowledge of medicines. And I think for many people who live with migraines, they probably already realize that medications is a really individualized process and it's not a one size fits all in their treatment.
Very much so. So there's been this term that's appeared on some of our materials about the new drugs, Emgality and Ajovy, quality use of medication. Now, what does that mean?
Yeah. Quality use of medicines is a really big topic, and it's got a few different meanings for people. I guess for me, in my practice, I work with people who live with chronic pain, and it's about managing the risks and benefits of that medication for that patient, obviously making sure that there's an appropriate indication for that medication as well. So that might mean, okay, with migraines, we're treating obviously a acute flare-up of a migraine, and we want to use medications that have got pretty good evidence that they're effective for that patient. In saying that, not all medicines are going to be effective for people. So it's about, I think, when I think about quality use of medicines, I really try and think of a goal that's specific to that individual, of what is the benefit for that medicine going to be. So that might be, I want to reduce my pain severity by maybe 30-40%, which would be a really good outcome. And I want to be able to enjoy, or be able to recover as much as I can from that migraine episode and return to work or return to the things that bring meaning to my life. So when I talk to patients about their migraines and how they impact their life, I'm looking for a goal in mind that might be specific to them, and then how we can use that medicine in the best quality way to have benefits for them. And I think sometimes what can happen is that we're not measuring the benefits of that medication for that particular person. So we're not seeing that there's a reduction in their pain experience, or there's a reduction or control of those acute migraine episodes. And maybe they're becoming more consistent and more severe, and maybe the medication's not doing very much. So it's about a very individualized sort of conversation with that person, understanding, what their goals are with treatment, and understanding if there is a benefit of that medication. Hopefully there is. Then the other side of it is when those medicines are not being very beneficial, and potentially they're causing side effects, or they're contributing to their pain condition overall. And so it's a lot of information to sort of unpack with people. And one of the things that I think is really useful for people that live with migraines, or anyone who has a chronic condition, is to book in an appointment with a pharmacist to have a medication review. So something that people might not be aware of is that we have accredited pharmacists, and you can get a referral from your GP to see an accredited pharmacist. They actually can come to your home, do a 1-hour medication review, and assess your needs, and then they write a report and provide recommendations to your GP, so you can have that conversation with your GP.
Wow, it's a really great service, particularly for those that are on lots of medications, and some of our people are, because of course migraine has a lot of comorbidities. So how else can the pharmacist fit into the care team ongoing? For a chronic condition like migraine, you need your pharmacist, you need a good relationship between your pharmacist and your other doctors. So how do they fit into the care team?
Certainly. I'm really lucky. I get to work in an interdisciplinary healthcare team. So I work with physios, psychologists, and doctors. And I think that is a really key thing to look at as someone who lives with migraines, is building, you know, your A team. And all of those people involved in your team should be bringing their A game and solutions to assist and help support you, and help with the coaching, mentoring, and the self-management. So I'm not necessarily spruiking that you should have this particular person in your healthcare team. It's about who you connect with, and who is supporting you. So pharmacists can certainly be a huge support, because the medications can be so complex in migraines. And I really see how pharmacists can assist patients is particularly in their flare-up management, acute symptomatic management of a migraine, what they can do around the therapeutic use. I recently was talking to a client who tried to avoid taking any medications until it got really, really severe. And really, medications work quite well for your acute flare-up before the pain gets really severe at the lower level. We know that that's really good evidence. And we also looked at a few other options that he could take in combination for an acute flare-up to help manage that migraine severity. And that really kind of changed things for him in managing that migraine severity. So, and then it's also looking at preventative options. And again, looking at, is that beneficial for you? Can we weigh up the risks and benefits? Like you said, many patients who have migraines also have other comorbidities or other conditions that can impact also their migraine experience. But there's some medications that can do both. So a lot of people don't want to be taking medications, and sometimes we can tailor their migraine treatment in line with their other comorbidities to sort of assist with both, have a medication that kind of does two things. So I think that's some really key things that pharmacists can do. They're also really good at recognizing and educating around medication overuse headache, which is such a common issue in the migraine community. So, and it's not, I feel like we need to spend a lot more time educating people who live with migraines around what happens with medication overuse headache. So unfortunately, sometimes if we take the medication too often, then it can actually cause more migraines. And I think if people know that information before they start taking the medication, it will help them in hopefully not going from that. I feel like if people have that information prior to starting those medications, they're less likely to go to that, from that acute symptomatic migraines to a chronic daily migraine or chronic regular migraines, which would be so helpful for people who live with migraines. The other things that
fits with our whole motto of treat it hard and fast. Don't wait for it to get chronic. Don't wait to be debilitated. You want to get it under control.
Early
as soon as you possibly can.
Yeah, definitely. The other things, I think pharmacists have a lot of information to assist with not just medications, but the non-pharmacological things like good sleep hygiene practices, hydration, regular meals. Say if you had diabetes, we know that there's a correlation between insulin and those sort of things. So it might be around managing your blood glucose levels to assist with reducing the migraine severity. So there's so many things that pharmacists can really do, not just around medication specifically, but also giving some education and empowering patients to look at their own self-management options. So I really think that pharmacists can impart a lot of knowledge, and knowledge is probably the most powerful thing for anyone who lives with migraines.
Absolutely. Now, the downscheduling of triptans. So this is triptans, which is a really common medication used to abort a migraine attack or stop it as it starts. We're downscheduled from needing a prescription to being available over the counter from a pharmacist, which is great news for people who know how to use them. And have been using them for a really long time. We have a bit of concern about people who don't know how to use them or aren't aware of MOH. So we'll, with good people like yourselves, keep educating on that front. But can you tell us what's actually involved in getting the triptans without a prescription? Do you need to present ID? Do you need to know the pharmacist? What's the deal?
So as of 1st of February 2021, the triptans were down scheduled so that you could get 4 different types of triptans are available over the counter from a pharmacist. Basically, to fit the criteria for a pharmacist to prescribe, you would need to have a previous diagnosis of migraines that's been diagnosed by either your doctor or, specialist neurologist, whoever it is. And you would have had to been treated with them previously from your doctor. So you would have received a prescription. It also needs to be safe and effective for that person. So if I was working in a community pharmacy and seeing a patient, they hadn't had a diagnosis of migraine, there is so many different types of presentations of head pain. And it's really, really so important that you have the right diagnosis. Sometimes triptans will be effective for other types of head pain, but that's not necessarily a good thing, because it could be, it's very rare, but it could be something more sinister, pathology that could be quite harmful to you. So the diagnosis is so important with migraines as a first option. And I think you should always go to your doctor first in your migraine treatment. And then we also want to make sure that that medicine is safe and effective, the quality use of that medicine. So if a patient is potentially using that more frequently, and I think more than 2 times a week is pushing it to medication overuse headache. And if they don't have any preventative options, I would be discussing with them about, okay, we really should be re-looking at your whole migraine treatment, see if, we should be starting a prevention treatment, because we really don't want to push into medication overuse headache. I work with most of the clients that I work with who live with migraines have experienced that in some form. And that's when we really see migraines very, very challenging to change in their pathology, and they become really refractory, as in no medication or intervention really seems to improve that until we've addressed the overuse of the medicine. So I think, just to summarize, if you were wanting to access a triptan therapy, I would say access it. You can access it from a pharmacy. Please make sure you talk about that you've been diagnosed, and you might have some extra questions around how you use that medicine and how often you use it. And we're just trying to make sure that you're not in any of those risk categories of no diagnosis or overusing that medicine unintentionally. Because we know that that is a risk of getting chronic migraines as well.
Awesome. All right. What would be your number 1 tip for how somebody can build a good relationship with their local pharmacist?
Pharmacists are super compassionate people. We really want to spend a lot of time talking with our patients and assisting them. And I think just talking to them and asking them their opinion about certain things. And I think that comes, a lot of people don't know probably the depth of knowledge that we have about medicines and certain conditions. So I think just starting that conversation openly with the pharmacist, I think you'll be really surprised how generous they want to be with their time, and also how much information that they do have, which could be really valuable to your healthcare. And find the right pharmacist for you. So same with a physiotherapist or a doctor or a GP or a neurologist, whoever it is, find the one that you connect with, because I think that really makes a difference to people's overall treatment when they have someone that supports them and is reliable and has solutions and the time to spend and talk with them and listen to them.
That's fantastic advice. Thank you so much, Nicolette, for making the time.
My pleasure.